Professor Dr. Glenn Moller, a passionate advocate of sexual reproductive health, who was one of the panelists, expressed disappointment in the lack of progress in family planning and population control, especially about protecting women and girls from related childbearing risks.
It's not just all schools. It's also the kids who are out of schools. And so we have to have access, we have to somehow get what they need as well. So why aren't there condoms in every street market in the city? My students distribute 10,000 condoms every time they do their community obstetrics day. 10,000 in one day, we distribute 10,000 condoms. There's an appetite out there. The kids know they need condoms, but there are no condoms. Let's have condoms in all the street markets. How much would that cost? Virtually nothing. The mamas are very happy to sell the condoms for a few toya and make a bit of extra money for their families. All we have to do is distribute them.
Dr. Luthi Amos from the National Department of Health said family planning is everybody's business. It's not only health. She says population control is owned by the Department of National Planning and Monitoring, but the health implements certain components.
And so when we talk about women's health and sexual reproductive health in Papua New Guinea, we really look at the delays in the decision-making. Firstly, delays in decision-making. So how would this person make a decision, a young person, for her not to get pregnant or to delay pregnancy? All of you have an answer to that. Decision comes from being able, if you're educated, you read, you don't have to be formally educated, but if there's knowledge in the community through your traditional ways of communication. So a person needs to know so that she can be able to make that decision. And then if she makes that decision, is there a facility, is there a place nearby where she can be able to access services? So now it comes to accessing service. So we appreciate partnerships like Maristops here, where the health sector cannot go, our partners go.
However, according to Professor Moller, even the educated are still ignorant about using contraceptives for not only preventing unwanted pregnancies, but also in promoting the health and well-being of women and young girls. Frida Kana, TVWAN News.